The vaccine has proven an indispensable tool in curbing the odds of severe outcomes for COVID-19 patients. But the recent threat of waning immunity means hospitalizations could peak in the approaching winter months. A new study of 150 patients hospitalized with COVID-19 has found that 73% developed delirium, a severe mental complication which researchers believe could make recovery from infection difficult. Researchers also noted that patients with delirium tended to be sicker, due to pre-existing conditions including hypertension and diabetes. The study's author Philip Vlesides, of the Department of Anesthesiology at Michigan Medicine, noted, COVID-19 is also associated with a number of other adverse outcomes that tend to prolong hospitalization and make recovery difficult. The analysis drew on data from patients admitted to intensive care units between March and May 2020 in a bid to identify common threads among patients with delirium. Findings revealed that inflammatory markers were more pronounced in patients suffering from delirium. Coronavirus cases and deaths are rising and a new risk factor has been identified. They suggested that this inflammation of the brain could be the key driver of confusion and agitation. What's more, the onset of delirium can cause oxygen levels in the brain to plunge, thereby increasing the risk of blood clots and stroke. The illness is a common complication associated with hospital admissions among people over 65. Along with diabetes, it is considered one of the biggest drains on healthcare systems around the world. Don't miss diabetes, the sign on your armpits of high blood sugar levels, insight, ibuprofen side effects, signs to spot when you go to the toilet, tips, vitamin C, signs you've had too much of the essential nutrient, insight. It is believed to result from a host of factors, including chronic illness, changes in metabolic balance, medication, infection, or medication withdrawal. Delirium is characterized by an onslaught of behavioral changes, but the overarching manifestation is a reduced awareness of one's environment, which can manifest in a host of different ways. Notably, a patient may experience an inability to stay focused, and may therefore often appear absent-minded. Alternatively, they may get stuck on an idea during a conversation and forget to answer questions. Sufferers may also find themselves easily distracted by menial things, or act withdrawn. Vlesides added, early on in the pandemic, we weren't performing standard delirium prevention protocols like we usually do. A big reason for that is early on in the pandemic, in the pre-vaccine era, we had limited personal protective equipment and were trying to limit COVID-19 exposure and disease transmission. A correlation between the use of high-dose sedatives and delirium was also observed during the study, according to the researchers. It is common to use 4 sedatives in the ICU, particularly for patients on a ventilator, added Vlesides. However, from talking to nurses, we found that patients with severe COVID-19 were inherently more delirious and agitated at baseline, perhaps prompting more sedative use. The researchers said the study highlighted the likelihood that patients hospitalized with severe COVID-19 will suffer some form of cognitive impairment. Overall, this study highlights another reason why getting vaccinated and preventing severe illness is so important, concluded Vlesides.